Simply Promise and you.
Hello everyone, this is Simply Promise and You. So today I'll be going around asking my fellow student nurses a very pertinent question. So as for today's question, I'm going to be asking them to share with me their most memorable and embarrassing moments during their clinical duty. So it promises to be very exciting, very fun, and just watch, guys. Okay. So today, I have a student beside me. So I would like him to introduce himself and share with me his most memorable and embarrassing moments during his clinical duty experience. So, bro, what's your name?
So my name is Charles Daniel Di Fancho and I'm from Section 3I.
Yeah. Okay. So, can you share with our audience your most memorable and embarrassing moment during your clinical duty experience?
So for me, I only have my most memorable moment when I have my clinical duties is when I first help a baby to be brought out in this world in order for the baby to feel and to enjoy the life that we live today.
Okay. So, what about your most? Have you ever had an embarrassing moment since your clinical duty?
So probably is my most embarrassing moment is when I get scolded by our CI in front of a patient, acting like I do not properly know what to do in handling the patient properly.
Okay. So, Ate, can you please introduce yourself to our viewers?
Hello everyone, I'm Akira Juris Changson representing 3I.
Can you share with us your most memorable and embarrassing moment during your clinical duty experience?
My embarrassment during, embarrassment?
And the most embarrassing and your most memorable moments during your duty?
Is it okay if Tagalog?
Yeah, Tagalog.
Okay. Itong kinakabahan ako, guys. Nung pinaka-memorable para sa akin, nung nag-OR. Feeling ko kasi isa ako sa part ng surgical team, which is true naman. Tapos, yung naman para sa akin, yung sinulat yung name ko doon sa logbook na kasama ka sa nag-perform ng operating.
Okay.
Yun po. Tapos yung embarrassment naman, yung kahapon, yung yung sinundan namin yung patient sa may comfort room kasi akala namin kwarto, yung pala CR. Yun lang po.
Hello, bro. Can you please introduce yourself to our viewers?
So, my name is Jade Kyrie B. Soriano. I'm from BSN 3I.
Your most memorable and your most embarrassing moment during your
So,
duty. You can say
okay.
it in Tagalog or English.
Pero, ang pinaka-memorable ko siguro is sa OR. Favorite ko kasi sa OR. So, yun. Ang mga case namin, naging case namin na is yung Tabso. Kasama ko si Charles Daniel Pancho, na in-interview kanina, na kumanta pa ng Maybe This Time. So, yun lang.
What is your name?
My name is Dayan Ongkiko from third year.
So, I would like to know what is the most memorable and most embarrassing period during your duty, Paul?
Can I speak
Yeah,
Tagalog?
speak Tagalog.
My most memorable experience during our clinical duty is when nung second year, and then pumunta ako ng DR, and then I saw someone like nag-assist ako ng ibang patient habang nanganganak sila, and then parang nahihilo ako doon sa mga nakikita ko. And then parang as a student nurse, parang mas na-feel ko na ito yung calling sa akin ni Lord nung nag-alaga ako ng baby, tapos nag-dressing ako ng mga bata, nag-dress ako ng bata, ganon, like that, nag-inject ng vaccine sa babies, like that. And then, yung most embarrassing moment,
Yes, Paul.
most embarrassing moment ko is nung may nag-collapse na kaklase ko, tapos nasa tabi ko siya, Tapos hindi ko alam kung ano yung gagawin ko. That's, yeah.
Please, can you introduce yourself to our viewers?
Hi viewers, I'm Enrique.
Okay. What has been so far? What has been your best and most embarrassing moment during duty?
Uh, for me, the best moment or memorable moment for me as a student nurse in the clinical duty here in the hospital is maybe my um, first ever actual in the delivery room. I think that's the most memorable for me because I get to actually first-hand experience how to deliver a baby, and it's so memorable for me. And the most um, embarrassing embarrassing experience for me is when we are in the region 1 in Binloc. Actually, I wasn't able to properly get the vital signs of the patient, and I was so embarrassed because um, the there's some condition with the patient, and I find it very hard to get the vital signs, and took me like 30 minutes, I guess, to get the
Oh,
vital signs.
okay.
So I kind of embarrassed that time.
So, bro, what is your name?
My name is Mark Jason Opandelio.
Okay. So, can you share with us your most memorable and your worst, or should I say, your most embarrassing moment during your duty? You can say that in your local dialect.
Nung second year ako nun, dito sa DR, nawalan ako ng conscious. Then, ayun yung embarrassing moment ko. Then, parang yun na rin yung ano ko, memorable ko. Parang mas lalo ako natuto. Ganun.
Okay, bro. Please, can you tell our viewers what is your name?
My name is Igwe Kinechukwu Mitchell, but I'm mostly known as Mitchell here.
Okay. So, what level are you, please?
I'm in second 200 level, first semester.
Okay. So, I think today is actually your first day on duty, right?
Yes.
So, can you share with us your experience so far?
I haven't really had much experience, but I would say I expected a little bit more because I'm not really doing a lot. I've assessed just one patient, and it was just checking the blood pressure. So I feel I should be doing a lot more than just that. Yeah.
So, so far, have you really had any language barrier so far
Yes.
in your dealings with your clients?
Yes. Almost every time, because when I try to assess the patients, it's either they don't understand me or they probably don't want to talk to me. I don't know why, but yeah, it's always the language barrier, and most times I have to pair with one or two other people that could help me translate and make everything easier for me. But yeah, without that, I think it's going to be much more difficult.
So, what are you expecting? Like, what are your expectations till the day you graduate from Lyceum, as specifically as regards to your clinical duty?
Okay, I feel I should be able to do the basic things and us should do like assisting in other features apart from just the vital signs, because I feel that's the major thing done here. I know being a nurse is a lot more than just vital signs, and yeah, I hope and uh, I want to be able to do that before graduating. So I don't want to graduate and be like I didn't do anything at all. So yes, I feel like that's the we have to put more and do more than just vital signs and basic stuff here. Yeah,
Thank you so much. I really appreciate it.
thank you.